Let me start off by outlining that government has set off to improve healthcare across Malta and Gozo. We started off when we discussed our beds plan with the Prime Minister with an ambitious plan to actually increase bed capacity by 500 beds across Malta and Gozo. And Duncan, that is very ambitious, and we want to actually achieve that. Having said that, we needed to prioritize the financing for the 500 beds. And part of that could be financed through the government purses, and part of that could be financed through PPPs or other means. Yeah. We started off by essentially looking at which beds could be financed through the public means, and we decided that 300 beds at Mater Dei would essentially be financed through government purses. We also wanted to do an upgrade of St. Luke's Hospital. We wanted to convert Caringrec into a fully fledged geriatrics hospital, which would be modern and reflects the needs of today. We wanted to introduce a new dermatology center at St. Luke's. We wanted a new rehabilitation center, and we wanted a modern Gozo hospital, which would be an acute facility. When we costed that out, the additional facilities, excluding Mater Dei and excluding the primary health hubs, so essentially St. Luke's and Gozo, the cost estimate was of 200 million euros, right? In parallel, while we were actually costing that out, we were actually in negotiations with Bart's Medical School to actually establish a base in Gozo. Bart's is a world-leading medical school. It has a very good reputation in research, and we thought there would be a golden opportunity here if we link the reputation that Bart's has and the brand and the goodwill with a prospective public-private partnership, which would be invested by the private sector, which would also attract medical tourism. In our discussions with Bart's, we agreed, and we actually included this in the contracts, that we would be in a position as Malta to leverage the brand of Bart's Medical School and the goodwill for promoting destination healthcare here in Malta. And the fact that you would have a Bart's teaching hospital in Gozo would facilitate the attraction of a private partner who would come in, invest, and also attract medical tourists, in addition to provide government beds. For us, that was quite important. What we wanted to do is that we wanted to improve the service at Gozo, revolutionize the service, essentially. The service needs to be at par with Mater Dei, if not better. Caringrec, we wanted a decent facility at Caringrec, a very good facility. We also wanted a top-notch rehabilitation center. To do that with normal financing, the cost per bed would be very expensive. And we couldn't afford a situation where the bed in Gozo would cost us as much as it cost us in Mater Dei. To do that, we needed medical tourism because we thought that through shared facilities with the private sector, we would be in a position to reduce the cost per bed for government. We believe that this formula, which includes Bart's, bringing in their name and reputation, together with their commitment to stay here for 15 whole years, together with a prospective partner who would attract both medical tourism as well as provide for the needs of government, would essentially work. Over the last Minister Saha, both myself as well as Chris Fern, we did get a number of companies coming on a regular basis expressing their interest in destination healthcare for Malta. Obviously, both my as well as Chris Fern's key objectives are essentially to retain healthcare as a free kind of service, as well as to raise the standards. But if we can actually attract medical tourism to actually elevate the costs of delivery, then obviously we believe it's a model which can help, and it can also support and improve economic growth. We are envisaging the situation where obviously the private sector will pay government for a lease for the land utilized at St. Luke's and Gozo. And they would have a number of revenue sources. They would be building the medical school for Bart's, and hence obviously Bart's will be paying rent back to the private operator.
I see.
At a pre-agreed rate. So essentially, Bart's are committed to stay here in Malta for 15 whole years. They will be paying rent at commercial value, so it's been defined.
Will pay them for the rent for the others having built the facility.
Correct, yes. So that's one source of revenue. The second source of revenue for the model will be the beds which government will be buying. So obviously that's the second source. The third source of revenue will be the medical private tourism. We wanted to structure it in this way because we believe that through shared services, if you have MRI equipment and different shared services, this equipment can be used both for the medical tourism component as well as the government services. The government workers will remain as government employees. That's a commitment we've clearly stipulated. That the collective agreements will be respected. The intent is obviously for the private sector will need to fund the salaries in the final cost that will be provided to us. Government intends to actually retain ownership of Mater Dei and also retain the clinical leadership of Mater Dei. But we have informed them that there are other opportunities across the health sector, and we did mention the Gozo and the St. Luke's opportunity to them, so they're fully aware.
So with Mater Dei, everything's going to remain as is?
Yeah, with Mater Dei, we intend to actually extend 300 further beds, essentially.
So they're not going to privately manage Mater Dei?
At this particular moment in time, we haven't considered that option. Our priority at the moment at Mater Dei is essentially to create an environment where we can actually address oral challenges. At the moment, we have people in corridors, so I wouldn't expect to have a private wing at Mater Dei when we have a situation where we have people in corridors. We want to address that situation, we want to improve that situation, and then once the situation is improved, one can consider whether there could be additional sources of revenue for Mater Dei, but only once we address our current shortcomings. I would like to thank Paul Patch for his ongoing efforts over the last year or so. I mean, I've worked very closely with Paul, as I have with the other unions. I personally congratulated Maria and Colin. Maria will be the president of MUMN, and Colin will be the secretary, will retain as Secretary General. We'll be meeting MUMN again next week on a number of things.